Hello and good day. My name is Shelagh Cooley. I'm with Common Good Vermont, and today I'm sitting down with Rob Gibson, Vice President of Marketing and Business Development from Vermont Information Technology Leaders, or VITL. And we're going to be talking about their upcoming summit this fall. Welcome, Rob.
Well, thanks for having us, Sheila.
So tell us, what is VITL and what do you do?
Well, Vermont Information Technology Leaders, or VITL, is a 501c3, not-for-profit, and we're designated by the Vermont State Legislature to develop, operate, and maintain what's called the Vermont Health Information Exchange.
The Vermont Health Information Exchange. Now, this is not to be confused with the health exchange for insurance.
Right. So the last year we've been hearing a lot about Vermont Health Connect, which is a mechanism by which Vermonters can go and sign up for insurance. This is very different than that. We need to be thinking about clinical data here. So when you go and have an appointment with your doctor these days, chances are, because 90% of the physicians in Vermont are using electronic health records, they're using some sort of an electronic health record system. And so what we're talking about in the Vermont Information Exchange is the exchange of that clinical data, getting that to the places where it needs to be between, across and among your providers.
90% of Vermont healthcare providers are using electronic records?
Yeah, that's the best we can tell. Part of our work at VITL is working with what are called eligible professionals or eligible providers. It's part of the CMS program to promote the adoption of electronic health records. Our e-health specialists have been working with providers across Vermont for the last 3 or 4 years, and so by our account, yeah, we think that's close to 90%, which is leading across the country.
Yeah, that's really amazing. Now you said CMS. What is CMS?
Well, CMS is the Centers for Medicaid and Medicare Services.
Okay.
And another mouthful. We're just like on any other industry. It seems like we have our own set of acronyms, so we'll try to keep those to a minimum today. But yeah, so as part of the Health Care Act, the Affordable Care Act of 2009, there were incentives put in place to help incentivize providers to begin to use electronic health records. And so as part of what was called the Regional Extension Center, our office helped those physicians adopting, using, and what's called meaningful use of those electronic records. So it's one thing to have an electronic record, but if you're not using it, what good is it? So.
Right, exactly. So what is the advantage of the electronic record and sharing that health information?
Well, obviously, when it's stored electronically, it can, that your clinical data can be shared much more easily. It can also be used to do comparative analysis from one visit to another. And so as we take that, which is what's happening in the office or within an organization, because generally an electronic health record system is installed across an entire organization. So what happens next is now what we really deal with is what's called health information technology. And so that's the computer systems and software that allow for the storage, sharing, and retrieval of that clinical information so that it can be shared across all of the providers who are involved in your care.
So could you give us an example from a patient's perspective?
Sure. Yeah, I think a good example of the type of data that's stored and then can be shared electronic are your lab results or blood tests. Almost, at least I know myself, every year when I go for my physical, usually I go a week before to the lab and they draw a little bit of blood and there are my results. Now, that all works fine if I'm all within the same healthcare organization. So if my primary care provider sends me to is part of Fletcher Allen and they send me to Fletcher Allen to have that test done, well, of course, they all have that information. Mm-hmm. But consider the case when I'm in a more rural part of Vermont.
Right.
And I'm sent to Fletcher Allen for that blood test. Well, that same result needs to get to my primary care doctor. And so the way that gets from one healthcare organization to another is through the Vermont Health Information Exchange.
So previously that was probably faxed or called over.
Phone, yeah, there were a lot of methods for doing that. And so what we've been doing over the last few years is really developing that network and that infrastructure, that basic technology. And this year we're rolling out some additional services on top of that to continue to enhance the care and provide even more information to the providers that they can use in caring for patients.
That's really fascinating. Now, is there sort of a fear around people sharing data? Because I know sometimes people worry about their data getting out there. And
yeah, and I think that's, I think, some people do have that concern, but many safeguards in place within the exchange. So first, the Vermont Health Information Exchange is a secure network. All of the data as it moves around and through that network is encrypted with the highest encryption standards. But basically the way data works and the rules for sharing that data is if I as a primary care provider order a test, then I'm able to receive the results of that test. So I'm directly asking for that test, and so then I get that result back. And so that information that flows in the terms of a lab order and then the results coming back, that's all just covered under normal, the normal relationship that you would have with your doctor. And you would, when you sign your annual HIPAA form, that covers that transaction. Now, as we get into some of the things we'll talk about today, and sharing your patient information more broadly, there is a policy in Vermont that covers patient consent. And so some of the pieces and some of the services that we're offering to providers will require a Vermonter to give their consent to allow that information to be accessed by any of their other treating providers.
okay, yeah. Now, did you have an image to show that would kind of help us understand this?
Yeah, I think at this point maybe we should call up image number 1. And really, and I know this is probably showing up pretty small on a TV set, and everybody's kind of going, whoa, what is all of this? But this is an architectural diagram of what is the Vermont Health Information Exchange. And it's really 2 pieces to it. The bottom section across the bottom of that graphic is really the secure network itself. And this is where what we show are the types of data that is exchanged through the network and is available through the network. And so that information is provided by hospitals, by primary care and specialty care providers. It's also provided by other care providers as well. And then sort of to the bottom left there, you'll also see commercial labs. Sometimes blood tests are done not just at hospitals, they're done by commercial labs. And then you'll also see pharmacy information and prescription information. So those are the primary sources of information that's provided into the network. And the way the network is structured is information from each of those organizations is structured and secured in its own vault. And so it's not ever commingled, and that's provided in. And so like I said, if your doctor were to order a test, a blood test for you, you would go and have that test, and the next time you show up in his office, the results of that would come into his EHR.
So from a patient perspective, you may not notice a difference, except for maybe there's a few more consents you need to give.
Right. So we'll talk about that a little bit. We probably ought to go back to the graphic then, if we're going to talk about that. So the bottom right there is sort of indicating that some of the larger healthcare systems, the hospital-based systems, they sort of have their own network, and we sort of tap into that as well. But across the top indicates some of the services and some of the provider services that are available on top of that health information exchange network. And well, to some degree, we're gonna kind of get a little bit out of order here, I think, but let's just move ahead. So on the top right, you'll see an individual sitting at a computer terminal. And that is a graphic that would represent your provider or somebody in your provider's office who's using a service called VITL Access. So VITL Access is one of the new services that we'll be rolling out this summer. And VITL Access is a system that allows a provider to log into the system and to do a query or a lookup of all of the patient information that's available within the Vermont Health Information Exchange. And that is a part that would require consent. So that's at that point where you're asking a provider who may be accessing information that's outside of their directed order.
Right.
That's when they need consent. That's when you or I would need to provide our consent and say, yes, it's okay.
Yeah.
So.
So that's when you would notice as a patient. But otherwise, from a patient perspective, maybe things are happening a little bit faster. Maybe it's a little bit more streamlined. But really, you're
yeah, it really is behind the scenes. It's
Yeah.
kind of like when things are working well. Yeah, you know, maybe the practice manager or the folks who are behind the desk when you check in, maybe they're looking a little less harried that day because they're not scrambling to get a fax copy of that just before you walk into the doctor's office.
right.
So, but I think it's also important to say that that really then begins to impact and change how healthcare is delivered. And I think that's the important attribute.
Tell us more about that. What do you mean?
Yeah, so, you know, a lot of people hear a lot about healthcare reform, and we really wonder what do people mean by healthcare reform? So really there are three aspects to healthcare reform. That's improving the patient experience, it's improving the health of a population in general, and it's also providing care at the most cost-effective manner without reducing the quality of that care that we provide. And so often that's called the triple aim of healthcare reform.
So if you're from the VITL perspective, are you working in all three of those realms, or are you focused on?
We do.
Yeah,
we do
okay.
work in all of those realms, and I think, again, we'll go back to this really busy graphic that we keep going back to. And let me just talk about three aspects of that. So I talked about improved patient satisfaction or improved patient outcomes through this. And one of those is the fact that, you know, if my provider can see a test or see the results from a test that might have been done at another facility 2 weeks ago, that may prevent them from ordering a second test.
Saving them money.
Well, saving us all money, but
Yeah.
who wants that second x-ray if you don't need it? Or who wants to have, you know, that second needle prick if you don't need it?
Yeah.
So, you know, from a patient perspective, that the ability for all of your providers who are involved in your care to be able to have access to that information certainly may eliminate that. It also, again, with VITL Access, when it's available this summer, will, you know, a provider will be able to log in and see your medication history. And you know as well as I do, when you go to the doctor, the first thing they say is, well, what medicines are you still on? And we all have trouble remembering sometimes which medications we're on, which dosages. This would also allow them to see that. So again, from a patient perspective, that translates
accurate.
to improved care.
Yeah,
right.
sure.
Right. The middle one I mentioned was population health, or the improvement of, in this case, all Vermonters as a population. And VITL works closely with different agencies to help in that aspect as well. In the graphic you'll see up in the top left that there's an arrow pointing out to what are called the 3 accountable care organizations. Accountable care organizations are a new type of payment model within the healthcare industry, and so that it's a shared savings model. And those organizations need that information in order to do comparative analysis. How I, as an individual or a small group of patients, how do we compare to a larger population? And so for that information that they need, VITL is working with them to provide that information to the accountable care organizations. We also work closely with the Blueprint for Health. And the Blueprint for Health is a program as part of the Department of Vermont Health Access, and the Blueprint for Health has community health teams out in 14 health service areas across the state. They work closely with providers, especially in managing chronic disease. And again, VITL provides that linkage and provides that information that they need for their clinical data analysis. So that's a way where we're providing information and helping to support that middle piece that I was talking about, which is the improved health of the population.
For the Blueprint for Health and for these accountable care organizations, where do they currently get their data from?
Well, accountable care organizations are new, and so they're just beginning to start up. And so in the past, they would have had to go to individual practices and literally pull up charts and hand transcribe that information.
Wow.
So that's
Incredibly time-consuming.
Right, it's incredibly time-consuming. And then the blueprint, we've been working with the blueprint for several years now. They have a clinical data registry system, and the information flows from the provider's electronic health record into the information that's required for blueprint flows into that clinical registry, and that allows them to do the population health management that they need to do.
That's really fascinating. Now, I never asked you, how long has VITL been in Vermont?
Well, VITL's been in Vermont. We were incorporated in 2005 as an outgrowth of the Vermont Hospital and Health Systems Association. I didn't say that right. Vermont Association of Hospitals and Health Systems, or VAHS. So it was an outgrowth of that. And then when we incorporated, then became a freestanding, independent organization.
Oh, okay. So, and you've been working this whole time on these things, but now, of course, with the Affordable Care Act, there's been some recent changes with these new organizations, the accountable care organizations.
Yeah.
Okay.
Well, so we've been working in the past to really build that infrastructure. As you can see, that graphic is quite a complicated graphic, and so as you might imagine, building that network from scratch has taken quite a bit of time. And so now what we're doing, we're really on the edge of providing services on top of that. So we're actually now being able to put tools in place that sort of fulfill some of these promises that we've been looking for in terms of ability to get access to clinical data and to be able to inform decision making at the point of care.
Yeah, that's really great. That's so exciting. It seems like after you've only been really not that old an organization.
Right.
Yeah,
right,
it's quite young.
Right. And we're still, I probably should have mentioned too earlier, we're still governed by a board of directors that is representative across the healthcare delivery system in the state of Vermont. And so, it's a little, they keep us, on course and making sure we're moving in the right direction. So all of our board members are representing some aspect of the healthcare delivery system. So we have representatives from the Vermont Medical Society, from VAHS, which is the Hospital Association. We have hospital CIOs. We have industry leaders that are in the health IT area. We have physicians. So it's a very representative board, and so we have that sort of input and guidance we need to make sure we're moving in the right direction.
And that organizational structure is, of course, supported by the fact that you guys are a 501c3.
Right, exactly.
Not a for-profit.
Right, right. But we're actually, and there is a piece of legislation out there that designates that we would be the provider of this exchange, because obviously, this isn't something where you want multiple competing exchanges, right? This is something where, we want one, we want it secure, we want to know that it's doing the right thing, and, so that's kind of our linkage, making us really a public-private partnership.
That's fascinating.
Yeah, thank you.
Do you want to talk about who your stakeholders are and your primary constituency?
Sure. Our constituents.
Have we left anyone out?
Oh, well,
Sure.
So I would say that our board is representative of those constituents, and I would say when we talk about our constituency, I would go back to three groups again. I would start with the general Vermont healthcare consumer. You and me as healthcare consumers and as patients, obviously all of this is being put in place to bring that better care, to bring that care more efficiently, and really at the end of the day to improve the health outcomes. So certainly that's one big primary constituency and stakeholder. The next is the providers themselves, and whether they be the doctors or the nurse practitioners or the clinical staff or the practice managers that are in that practice, those folks are the folks that will actually utilize the solutions and systems that we're putting in place. So they're certainly a major stakeholder group, and a group that certainly we want to demonstrate to them the value of a tool like VITL Access, make it known that using a tool like that's going to give them the ability to deliver better care to their patients. And then the third constituency would be then those organizations to which those physicians and healthcare workers belong. So whether that's an accountable care organization, or whether that's one of the hospital systems, or whether that's an independent practice, any of those. So organizationally, sometimes, roles are a little bit different than the individual providers within that. So.
Yeah, so when you're thinking of your constituency, you must have to think about ways to convince them that this is a worthwhile endeavor to become a part of?
Right,
and
right,
How do you do that?
Well, we do that in several different ways. We'll be talking about the Summit, which is our annual conference, and that's where we invite these stakeholder groups, particularly the provider groups, in to sort of see what's new and what we're doing. But we're also embarking for the first time on an awareness campaign where we will use media channels to sort of get the word out. So we actually have in development right now a two-pronged media strategy. One targeting that general Vermont healthcare consumer, and another one targeting the Vermont healthcare provider. So that's in development, and I would say, sometime this fall you'll start to, hear from us a little bit more. So.
Oh, that's great. Yeah. Now, did you have any data that you wanted to show us that would be worthwhile?
Well, I think some people say, well, it's a complicated network, and you show, and you show that, and well, what does that really mean in full terms? So we do have a couple of graphics that show the different types of organizations that are contributing data into the health information exchange. And so you'll see here that there are hospitals, and all of the Vermont hospitals, as well as some of the adjacent hospitals that treat Vermont patients, are connected into the Vermont Health Information Exchange. We also have over 150 different healthcare provider organizations, whether some of those are hospital-owned and some of them are independently owned. Over 150 different practices connected to the Health Information Exchange as well.
How many practices do you know? How many practices there are in Vermont?
Well,
is there a
yeah,
number?
That's a hard number to actually pin down. We don't really know, but we believe we've got a fairly high percentage of those, especially primary care providers. We're now reaching out a little bit beyond that. We're reaching into specialty care. We're also beginning to reach into home health and hospice services. We're also beginning to reach into long-term care, and there are also a few commercial labs who are connected. So with any exchange, the broader the set of, or the more sources of information, that really rounds out, again, back to that patient perspective, that really rounds out the fact that all of the information about my care is going to be available to any provider in a variety of different care settings. I mean, because generally we'll think about our doctor in our hospital.
Right.
But we won't often think about the rehab center, or we won't often think about the home health. So those are important care settings as well.
Yeah, I mean, this is sort of like when you take your car to the mechanic that can do everything versus having to take your car to the muffler guide and the transmission guide and the...
Right, and sometimes those systems can be, to use your automobile analogy, sometimes the exhaust can be worked on by itself. But sometimes the exhaust guy needs to know what the engine guy did.
Yeah. It's all connected.
Exactly, and so that's what we're really working towards here is an exchange that allows the muffler guy to know what the engine guy did a couple of weeks ago, because that may very well have an impact on what he decides to do to your car.
Yeah.
So.
Yeah, that's great. Well, I had no idea that it was so expansive. I have to say this is really enlightening for me. So, what is the role in the healthcare reform for VITL? Well,
we've touched on several of those along the way. So, it's difficult for healthcare reform to happen without a robust health information exchange. So, we are not alone in terms of having a health information exchange. These are generally regional in nature. In the state of Vermont, we're small enough we have one health information exchange for the state. But, if you look next door in New York, they have a dozen or so regional exchanges that then get connected together at a statewide level. And so, this is something that's happening across the country in terms of the establishment of these health information exchanges. Healthcare reform is happening in Vermont in a number of ways. So being a part of Blueprint and providing the data that they need is a part of that. Providing the data that's needed to the accountable care organizations, that's part of that. Delivering VITL Access, which we've talked about a bit here, as a service to those providers, that that helps to usher in some of that reform we've been talking about. And then some of the other services that we'll be putting online after that will also help continue to move that health reform effort forward. We also have representatives on our board of directors from many of the agencies within the state of Vermont that are part of healthcare reform. So we have representation from the Green Mountain Care Board, for instance. So we have that linkage into what they're doing from an overall healthcare reform effort.
So recently there was the Supreme Court decision about removing the buffer zones, brought up Planned Parenthood back into to the forefront of everyone's mind. And do they feel differently about this? Because I know they protect their data pretty carefully.
I think
compared to other healthcare providers.
Yeah, there are certain areas where data is more treated more specially. Certainly, the one you mentioned, reproductive data, and then also mental health data. And so both of those are areas where today, for instance, with mental health data, we're not accepting mental health data into the network because we haven't completely, fleshed out a solution for making sure that that can be shared everywhere that it needs to be, in the right manner at the right folks. So there are still some limitations from that standpoint, but in general, most of what you would think of as your physical health data, most of that's really available now.
Interesting. So there's still some ways to kind of keep it closed or secure to some providers and not others.
Right. Well, or what it does is, so I think one thing that's important to note throughout all of this is that the health information exchange is never a complete picture of all of your information. So we should think of the health information exchange as that most pertinent information as you move from care setting to care setting that somebody would need to know about you. So to some degree, not everything that your individual physician would have, not all of that gets transmitted into the exchange. Basic lab results, transcribed reports from radiology, x-ray, other things like that. So sort of that in the medication history that we talked about. So it really is a basic set of health information that's on the exchange.
So maybe your dermatologist doesn't need to know about your digestive health issues or something.
Well, and again, unless they directed that test, they wouldn't see the results, unless, of course, then as we move into VITL Access, if you
give them permission.
If you give them permission through that consent process that we were talking about. So we did have a short video clip, so if we want to talk like VITL Access, because we're kind of back around to that again. So VITL Access is again, is the new system that we're putting out this summer. We'll be talking about it quite a bit at our summit coming up. And this is the tool that allows a provider to securely log into a portal and to query and to look at all of the information that's available on you or me as a patient. That's the piece would certainly require patient consent. We've been in a pilot program with 7 practices across the state of Vermont as part of this leading up to the rollout this summer. And the clip will show Dr. Newton up at North Country Hospital. He's an emergency room doctor, and he talks about how having the access to that medication history is important to him and how he treats patients that come into the emergency room.
Okay, great. So this will be Dr. Newton talking about VITL Access.
People are in the emergency room because there's something that's not going right, and so you have to make some sort of change. And being able to understand all the medications that someone has been on before, and being able to figure out if they've actually been compliant with those medications, all of that's critically important, and that's information that we can get easily out of VITL.
VITL Access has been really important to us because parents aren't always able to give a good history about their child. So for example, kids will sometimes go to the emergency room with their parents because they're ill and they'll be put on medicine, but the parents won't understand what the medicines were or what happened in the emergency room. And so it's very helpful for us to be able to look at VITL Access to find out exactly what did happen when they were seen and what medicines they were put on.
So do you want to now talk about, we've kind of mentioned the summit this fall, and we've talked a little bit about outreach and constituents, but could you give us, this is the summit that's in September?
Right. So our annual healthcare summit. This is our big event for the year, where we invite, again, predominantly our provider community in to learn not just about what VITL is doing, but learn about health information technology trends across the country. So the dates for the summit this year are September 8th and 9th, and it will be held up at the Sheraton. And we're excited this year to have an incredible keynote speaker. So Dr. Karen DeSalvo, she is the current national coordinator for health information technology. So imagine your boss's boss's bosses, I don't know how many bosses up, kind of coming to dinner, right? So we have that advantage of having Dr. DeSalvo. So she brings a national perspective on health information technology. She brings a perspective that I think only somebody in her position in the Agency of Health and Human Services could give. So we're just excited to have her as a keynote speaker for this year. We have a lunchtime speaker that brings sort of a patient perspective into things. So Dave DeBronkart, he's better known in the community as ePatient Dave. And so Dave survived very serious cancer a few years ago, and through that experience that he had, he realized how empowering it is for a patient to have a role in their health care. And so he is an encourager and a motivator, really encouraging patients to be involved in their care. And he authored a book called Let Patients Help, which really is sort of his book, or basically the way he encourages people to be involved in their care. And he also has pretty strong words for the provider community as well, that your patients know more, we know more about ourselves than we might give ourselves credit for. And so always remembering that patient perspective. So the conference is anchored by two very dynamic speakers, and so we're excited about that part of it.
Yeah, that's great. How many people are you expecting?
Well, we generally, we're expecting around 400 people this year.
Wow.
And that would be a significant increase over past years. We've been doing the summit, I believe, every year since we've incorporated. Last year we had about 300 people in attendance, and we're really hoping to really up that attendance this year. What we do is we offer 4 different tracks with 3 sessions under each track to provide more information to those providers and the provider community and those involved in health information technology. So CIOs will come to this, and practice managers, people who are engaged in that technology, implementing this technology in their providers' offices. So we have 4 tracks with different topics that hopefully will resonate with our community as well too.
And so this is mostly the practitioners. So again, it's the technology people, it's the doctors, the hospital, admin folk. What are the 4 tracks?
Also, the 4 tracks are, let's see if I can remember them all from memory.
To put you on the spot.
Yeah, one is called Access to Clinical Data, and so that's the track where we'll be talking about the services that are offered through VITL. So we'll be talking about our VITL Access service, and we'll be talking about some of the other services that are being provided by VITL later in the year. So that's one track. Another track is managing evolving requirements. So many of these practices, you might imagine, we mentioned Blueprint for Health, we mentioned accountable care organizations, the organization to which these providers belong. All of them have different requirements for data quality and data measures that need to be taken in place, and so there's quite a labyrinth that the provider has to navigate through. So that track will help a provider understand those evolving requirements. We have another track on healthcare reform, so where we'll speak to some of the healthcare reform efforts that are underway in the state of Vermont. And then the 4th one is the one that I'm struggling with.
We'll come back to you.
Yeah. Can I reach down?
So how do people register for the summit? How can
So
they
the easiest way to register for the summit is going to either our website, which is VITL.net, and from there you'll see right at the top banner a link to the VITL Summit, and then, or you can go directly to the registration site, which is VITLSummit.net, VITLSUMMIT.net.
Oh, that's really easy. Now, would you recommend, is this something that teams should go to from an organization, or is it okay for individuals to go, or what's
right.
the...
No, that's great. And so we do have a group discount, so we actually encourage people to attend as groups from their healthcare organization. The registration is a $99 registration fee, and then there's a group discount for any group of 3 or more.
Fantastic. So
Yep.
you can get your buddies to come along.
Exactly. and I should have mentioned as well, too, with respect to the summit, we are trying to extend the summit a bit longer, and so I mentioned that it's 2 days. The first day of September 8th, basically what we're doing is we've invited 5 other HIEs from across the country to come and sit on a panel with us and to give a national perspective to how they're having an impact on healthcare delivery in their state. And so on the afternoon of September 8th, people can participate in this panel discussion, and they can hear how healthcare, health IT is transforming healthcare around the country. And so that will lead right into evening reception. And so that'll be a nice way if people are traveling in to the summit, they can come in a bit early that afternoon and participate in that, have a nice evening together to socialize, and then the main event then is September 9th. That's the full day that we're packed, 8:30 in the morning until 4 in the afternoon.
Now, you were saying in your constituency that there's some people, the extended care or the home care, maybe the specialty stuff, that you're reaching out to. Would this be a good way for them to find out about VITL
Absolutely.
if they came to the summit?
Right. So we would definitely invite anyone who's involved in healthcare delivery, no matter what type of healthcare setting they're in, would certainly be a way to do that. And certainly they'll find, within those tracks, they'll find information that's relevant to them.
Okay, great. So that I'm here talking with Rob Gibson. He's the Vice President of Marketing and Business Development at the Vermont Information Technology Leaders. And we're talking about the VITL Summit, which is going to be held on September 8th and 9th this fall. So if you are a healthcare provider and you want to know more about the Vermont Information Exchange, did I say that correctly?
The Vermont
Health Information Exchange. I forgot one word, sorry. Then you can go onto VITL.net, VITL, or VITLSummit.net to find out more about their summit this fall. Well, Rob, thank you so much for coming on and telling us all about VITL and the work you're doing. It sounds like it's so critical to health and to Vermonters' health, to the practitioners providing health. Do you have any closing thoughts for us that you'd want to leave us with?
Well, I think I'd say as a closing thought, I would just go back to our theme for the summit, which is informing healthcare decisions. And in providing that information at the point of care, getting the right information to the providers when and where they need it the most. And that's really, I think, the driving force behind VITL, and really the driving force behind what we do. So, and then just with that, just a continued invitation to attend and to thank you for the time today.
Yeah, absolutely. Thank you so much for taking the time to explain to us what VITL is and the great work that you're doing. It's really impressive.
Well, you're welcome. Thank you.
Thanks.